Everyone who has TMJ should at least be imaged to see what's going on in the jaws and to make a educated decision after that as to what to do.
Okay, so where are you from?
Los Angeles.
So 2 years ago, we saw you and we did DTR for you, and it helped you a bunch, right?
Yes, it did.
For what, I think it was 14 or 15 months?
That's correct.
Or longer, and then you had something go wrong with the teeth, basically.
Right.
Things broke, and then things returned with a vengeance, right?
That's correct.
So what's your experience now that you've had it done a second time? I mean, this time we pulled out all the stops and we did the imaging too. We did the MRI,
Right,
the CT over again, and we found that you were a little bit damaged, but not terribly so. And back when I saw you two and a half years ago, we weren't doing MRIs at the time,
Right.
only CTs. So we were able to see that the cartilage or your disc was a little bit, damaged, but lots of people are a little bit damaged. So bottom line is things were stable and adapted enough for us to try this. You've told me in the past that other people that you saw or communicated with, they do not image, right?
That's correct, yeah.
And what were they suggesting they could do for you that would help you?
For the most part, it's just night guards or splints.
Yeah.
I had one person try to sell me a package that would take me from a splint to, I don't know, capping my teeth. I'm not really sure.
Yeah, for the bottom dollar price of?
About $60,000.
Wow. And that's pretty much the mainstream. The TMJ specialists, it seems, that you're running into, they were all convincing you that they could fix you orthodontically or with splints or with crowning all your teeth, right?
That's correct.
Right.
I haven't heard anything else.
And no one had ever bothered imaging you or measuring you in certain ways like you've seen here?
Never.
Okay, so what do you think about that?
I think everyone who has TMJ should at least be imaged to see what's going on in the jaws and to make a educated decision after that as to what to do.
When you saw other people, did they ever pull out sensors and computerized technologies for that?
I saw one person that had a T-scan,
Yeah.
but he made me a guard that honestly made my TMJ worse, so.
Gotcha. Do you remember him manipulating your jaw backwards, like kind of playing with it and pulling it back or anything?
Maybe.
Yeah.
It was quite a while ago, so I'm not
Gotcha.
sure. But
What advice do you have for people in general that have TMD issues?
definitely do all your research and know what you're getting into before you get into it. There's a lot of dentists that will sell you packages and you don't really realize what you're getting into until you're, months or years into the treatment. And so it's really important to do your research to begin with. I would suggest that people at the very least come here to get imaged by you so you can give them
The neural occlusion screening.
Yeah.
The imaging, the EMGs.
So we can
the
give them a
bite.
good assessment about what their problem is.
Mhm.
Sometimes it'll be muscular, sometimes it'll be something else. At least they'll know
Yeah, the
what they're
DTR
dealing
doesn't
with.
fix them all. It
Yeah.
doesn't. I flat out say that all the time.
Right.
And, that's something that we do. That's one of the treatments that we implement. But, we run into all kinds of crazy things because we see
Right.
people from literally everywhere. And DTR is not a panacea.
Right.
Neither are splints.
Right.
Neither is surgery. And who knows when surgery is really indicated unless you've been imaged. How many people go through braces and oral surgeries that never got an MRI of their joint? Like the joint doesn't matter. The joint matters because it changes the bite.
I would say that about braces as well.
Mhm.
If you are going to get braces or your child, you're having your child get braces, have them imaged before.
If something looks funny, for sure.
At the very least.
Yeah, in an ideal world, everyone would get an MRI before any of that happened, but that's not going to happen. But dentists and orthodontists and oral surgeons should learn that, hey, before I break that jaw or remove those teeth on this really strange bite, I should probably image the joint. That would be smart.